my name is Asijah Campbell. I'm doing home births are better than hospital births. Again. How many of you guys and girls ever experienced a hospital birth? It probably was a little scary, right? All the wires and computers and just hospital period gives you a scary ride. Nobody wants to be there. But there's another alternative, home births. Home births are better than hospital births because I believe that. I believe that because one, it's safer for the mother, two, it's safer for the baby, and three, it's a more comfortable and relaxing experience. These are the three main points I'm going to address with you today, and hopefully when you have your next or your first bundle of joy, you will feel the same way. It's safer for the mother because who doesn't feel safer at home than at a hospital? I believe the mother is more calm at home because she doesn't have to hear other patients screaming. When you in delivery, you hear other women in other rooms and everything that can make you nervous. That will cause her to get nervous and afraid, which will affect the baby. According to Home Births Are Safe 2009, a large study conducted in Canada proved that 5,418 women process and fold more naturally with the midwife at home. Paragraph 6. Babies can also develop high blood pressure due to mom's stress, which can follow into their adulthood. I think we can decrease this by the mom walking down her own hallway or around her own home with her midwife rather than a hospital hallway, seeing other patients in pain, or even getting into her own tub at home rather than a hospital bed with a lot of unfamiliar faces staring at you in a tub, staring at you in a tub. That can be very uncomfortable, right? I don't know where that comes from. But also the comfort of tossing and turning in your own king or queen size bed with big fluffy pillows to squeeze on to ease your pain instead of the limited room you have in a hospital bed. Another reason it's not only safer for the mother, but it's safer for the baby, because if the mother is not happy, the baby is not happy. So we need her to be as comfortable as possible. Most women, when they go in the hospital, the doctor tells them there's a chance they can die by bleeding to death or even paralyzed by epidural. That can be nerve-wracking and scary, so all the mother's emotions is going to the baby. We can make this information less intense by telling the mom at home, around family and friends in a normal environment rather than a scary one. Women can take risks at hospitals that they never expected. For example, sometimes the baby's shoulders can get stuck in the birth canal after the head comes out. In a hospital, sometimes the mothers are forced to use forceps and vacuums at hospitals. This can cause the baby to come out with a cone-shaped head. This happened to my sister. She had to get her baby sucked out because when she was in the hospital, she didn't like the doctors touching her or putting their hands on her. She was trying to jump out the bed from the pain. They couldn't restrain her, so they had to use a vacuum to get my nephew out. And she was scared. She thought they was gonna hurt her baby and everything. This can cause the baby to come out with a cone-shaped head. It eventually goes back to normal size, but what mother wants to see their baby sucked out or pulled out by the medical instrument? My last reason is it's more comfortable and relaxing experience for the mother and the baby because the mother is around family and friends. A midwife who was there since the beginning of her pregnancy. I had a midwife. It was very helpful. She had me rolling on the ball, rubbing my back. She was really nice. I had no epidural. I went natural. And she made it very relaxing for me. I would have felt more comfortable at home because I had too many doctors coming in and out of the room, which made it uncomfortable for me. Even though my midwife was there, it still was different faces coming in. But the only one I really knew was my midwife. According to Brian Allison, Place Matters 2016, in recent years, the likelihood of planned and actual births outside of hospitals settings has increased. driven partly by some women's desire to avoid medicalization of the process. Paragraph 1. Studies show that giving birth at home can be just as safe and can even lead to more positive outcomes for mother and the child. I believe this is the best route because it's safer for the baby. Everybody wants their baby to come out normal without complications. Due to the mother's stress, and having a home birth avoids that. In conclusion, home births are safer for the mother, the baby, and overall a more relaxing experience. You don't have to worry about being forced to use a vacuum to pull out your baby head, and you can avoid many different medications. So when your loved one, or even you have your next baby, try it. I promise it will be a more relaxing experience than a hospital. Not only for the mother, but for the baby. And the baby is the more important thing. Oh, this is not any more age. Because I don't have nothing else. You want